An issue creating plenty of emotional debate. The Congressional Budget Office says 24 million Americans will lose health care insurance by the year 2026 if the Republicans repeal Obamacare.
Supporters call it a needed change, but now some Nebraskans say it could cost them coverage. 3 News Now reporter Megan Stewart is live with the details. Megan?
We're hearing this fear and anger voiced at Nebraska lawmakers. One doctor I spoke with said, to sum up the issue, this is the first time in history we're not limited by what medicine can do, but by who will pay for it.
If you would support legislation or an amendment to restore those benefits.
Emotions ran high at U.S. Congressman Jeff Fortenberry's town hall meeting Monday as constituents voiced their fears over health care.
What makes you think that a universal health care system will not work in the United States?
Well,
many Nebraska lawmakers have shied away from holding town halls or other public events, concerned about confrontation like this. But it isn't just the lawmakers getting peppered with questions.
Doctor, what do you think is going to happen? Doctor, the treatment that you recommended or the test that you'd like to do, will my insurance cover that? And I can never have an answer for that. I don't know.
Family physician Gregston Nelson says every day he deals with patients concerned about long-term care, coverage, and affordability.
We try to minimize that by writing mostly generic medicines. A lot of pressure from the managed care people to do that, and I think in this practice we're averaging over 90% generic medicines.
As Washington sorts out what a repeal and replacement of the Affordable Care Act would look like,
lower taxes, lower deficits, and the most significant entitlement reform in history.
Locally, as concerns continue to mount, patience is wearing thin.
You can't talk about the budget just when it's about health care and not talk about the budget when you're going to put up a $40 million wall.
A big criticism of the Affordable Care Act right now is the high premium cost, leading many to choose plans with higher deductibles. For Dr. Nelson, he says he charges about $100 per visit, and with a $5,000 deductible, you'd have to see him 50 times before insurance picks up the tab. Reporting in the studio, Megan Stewart, 3 News Now.
Tonight.